everybody. This is ZOOMERTIMES TV, and we are featuring this morning a great group of people, all from Perfect Edge Botanicals. And so I'm going to ask each person to say their name, and then we're going to get started. So let's start right now with Scott.
Good morning. My name is Scott Norwood, and I'm live from our office in Margate, Florida.
Okay, and then we have Eric.
Hello and good morning. My name is Eric Robinson, and I'm live from my family room. And I couldn't get to the office for some reasons that I probably shouldn't talk about. But
okay, all right. And then we have where are you, Rob? I don't see you, but I know you're there.
I'm here.
Talk about you, and there's your 100% natural or botanical grown in USA. Perfect Edge.
Good morning, Anita.
It's Rob Nosel, right?
Yes, Rob Nosel calling you also from Margate, Florida.
Okay, well, let's get, and then we have our superior guest who we're featuring, and of course, that is Michelle Fein, and she is a psychologist working with people to help through this pandemic and other things. Good morning, Michelle.
Good morning, Anita. Good to see everybody.
Right, so, you know, it's interesting that everybody usually needs a psychologist, whether there's a pandemic on or not, but what is this doing for you in your practice?
Well, Anita, I typically take a holistic approach to things, and we know that everything is interconnected in our body. It's not just our brain functioning by itself, and we know that stress, especially with the pandemic, is a huge factor in the development of mental health issues and illness and that sort of thing. PTSD, OCD, anxiety disorders have constituted the highest of mental disorders before the pandemic. And now with the pandemic, we're seeing a big rise in mental health issues. So it's a very, very big problem. We know that chronic stress impairs the signaling in the brain, which leads to anxiety and obviously potential other health issues. So typically I ask people to get comprehensive blood work. I like to get a baseline of what's going on with them. I look at nutritional deficiencies, genetic factors that may play into their symptoms and have an effect on mental illness. We look at diet, exercise, self-care, what they're telling themselves, and how that affects how they feel. So I was introduced to hemp oil initially when my son's physician recommended it for him. And
what was his problem?
He had social anxiety and trouble with concentrating and attention. So after I did a lot of research about it and I found that it has a lot of healing qualities, I actually started taking it myself. And I saw the benefits that it had for my son, and it helped me a lot with neck pain and back pain and everything that's inflammatory. And I actually got to see firsthand for myself how helpful it was for me. So when patients now come in and ask me for, a lot of them want natural stuff. They don't want to be on anxiolytics and antidepressants and that sort of thing. So they ask me for something natural to help them with their symptoms. So I recommend to them to actually research and understand and educate themselves about hemp oil, and obviously consult with their physician if they decide that that's something that's right for them. And after doing all this research and trying different brands, I basically stopped doing all that research when I came across Perfect Edge Botanicals. Because it's natural, it's organic, it's kosher, it's safe. I have access to a certificate of analysis with every batch. Everything that I have, I know what's in it. So I've seen tremendous results with it in my practice. I'm very pleased, and it's something that I really, really believe in.
So Rob and Scott and Eric, you can go home. She's the best. She's like, she's everything you would dream of. I mean, isn't that fabulous? And you're not as cute as she is too, so I don't know.
Yeah.
You guys are cute. You know, it depends who you're looking for. But Rob, just, you know, because I've known you for many years, and of course you were in a different business at the time. So how do you feel about Perfect Edge Botanicals? Why did you jump into this?
Well, like Dr. Fein has said, we're seeing so many different results from humans to pets, and it's very rewarding. In the financial business that I was in before, people are skeptical about you because you're trying to sell them a stock, a bond, a municipal bond or something. Here, you're just giving it to them and saying, here, try this, and it makes you feel better. A lot of people, it takes the edge off. A lot of people say it flattens them out.
And Scott, you've been a friend of Rob's for a long time, so who discovered this? Did he say, hey, Scott, I've got this miracle I have to talk to you about? We never talk about miracles, but you have to believe, Scott, you have to believe that this is pretty spectacular, isn't it?
Yes, ma'am. First of all, I want to remember to go to you. We started as friends back in the 80s in the television business, and I'm born and raised here. And Rob said, hey, we have a mutual friend, and I had real bad hands, so we started taking it, and I can play golf again. So that's how I got involved. And of course, Rob and I were in the television business in the 80s and been friends, and Eric also for a long time.
And that's how that started. So now, Eric, you know, you have quite a history. Why don't you tell people a little bit about you and why, of all the things you've done, you're really spending a lot of time on this?
First of all, not only am I the most handsome guy on this call,
Right.
And the most humble.
but I used to support my family by beating people up for a living. I played professional football, and if they could have gotten somebody tougher, they would have. You know what I mean? So they paid me to do this, but as a result, I have a lot of chronic pain, and I'm telling you, I have 2 6-inch rods in my back. I have a titanium left knee. I have a totally rebuilt left shoulder. My foot, if I showed you a picture of my last day in the NFL, my foot was literally, my knee was pointing north and my foot was pointing southeast. However, okay. I was also academic All-American. And I was vice president of sales at Quest Diagnostics. I launched the quinolone antibiotic Levaquin. I launched the quinolone antibiotic Floxin or ofloxacin. And I sound like I'm bragging, and I'm trying not to. But
we're trying to figure out your credentials and why you like Perfect Edge, because that's different.
Well, here's the reason. I had a dog that was 12 years old, and I gave her some CBD oil. Now, there's no placebo effect with CBD oil in a dog. You can't tell the dog, hey, I'm going to give you this and you're going to feel better. That's not what's going to happen. Like, it doesn't happen. So, when I started doing that, then I started taking it. I took this stuff, and it was the most amazing. You know when you realize CBD oil works is when you stop taking it. That's what I'm going to tell you. And there's nothing else. You just don't know how, like, for someone who has chronic pain like I do, it has allowed me to cut my dose of Advil. I'm a science guy, so I'm going to tell you something. There's a pharmacogenomic test you can take. Like, Tylenol does not work for me, but ibuprofen does. And it improved my life so much. And it took because there's all kinds of issues with ibuprofen, and I'm telling you, mainly they're kidney issues. I can see Dr. Fein nodding. I'm telling you, it's not the greatest drug, but it does help.
Well, let's get Dr. Fein in here, Eric. Thank you, Dr. Fein. So
welcome.
you've heard somebody, it's probably, Eric, it represents a lot of your patients. I mean, some come as athletes, some come just as housewives. People come in different, worlds. So how do you know what to offer them?
You mean in terms of therapy or?
Yeah, therapy, including, of course, Perfect Edge, but the whole gamut. I mean, people are on ibuprofen, they're on different things, but I don't like pharmaceuticals or I don't like strong drugs either. And that's why Perfect Edge can be an answer, can it?
Yes, it can. I think what we really need to look at is what's going on today. We are going through what I call collective trauma. This is a traumatic time. When we're past this, we're still going to have some residual mental effects of this. This is trauma. And what we know about anxiolytics and medications is they help with the nervous system, but they don't help with regulating the learning process of aversive memories. What does that mean? That means that there's a cognitive component in our thoughts that has to do with processing trauma. Medications don't help with that. CBD has shown to help with that, with the processing of the memories. So it also helps to enhance the extinction of persistent fear memories, meaning that you can get rid of it quicker because it calms down your nervous system. When something calms down your nervous system, you're making space for the logical part of the brain to come in and intervene. When you're hanging off a cliff, you're not going to listen to me saying, okay, take a deep breath and try to think about the distortions that, you're hanging off for dear life.
Right.
So we need to calm that down before we make space for the logical part of the brain to come in and intervene. So that is something that I found very, very powerful and that you can't find in medications today.
And I was thinking about the family. So I'm sure you've been dealing with the patient, but actually their families are all affected by this, because if you have a mother or father who are now distraught, they don't want you coming to the house. I mean, you have to allay those fears, and you're probably going to have referrals to their family members.
Absolutely. Yep. It's a very, very difficult time. It's a trying time, and we're not used to it. It's something that's completely, it's a new reality. It takes a lot of adjustment. This is going to be around for a while, so we need to kind of buckle up and get through it.
Well, I'm glad that Rob and Scott and Eric found you. You're a very smart and very charismatic person. It's really important because people need to trust, just like I've known Rob a long time and I trust him. So Rob, this is the one thing that I hear about the CBD oil botanicals that you have. People can buy it anywhere. It's being advertised everywhere, but they don't really know how much to take. And that's something that you and Scott are very good at. Do you know how to tell them? And of course you have Dr. Sferrazzo, who is, very involved with you and can help too. So how do people know? I see you have there in the back of Scott, you have like a whole shelf of your products, and maybe it's a good time to just grab a few and explain that. So let's say you have a dog. People have dogs, but they have themselves. What would you, if you have a friend and a friend needs something, what would you offer them to buy? So Rob, you can, you're there with him. Why don't you go over this then?
All right, so it's really, everybody's different on how it reacts in their body. A couple of things though. Hemp is a remediator of soil. So whatever in the soil is going to be very potent in that oil. So Anita, would you buy gas station sushi?
No.
Okay, so people are selling it in gas stations. You have to know where the product is sourced from. Ours is obviously sourced from Colorado. As you mentioned before, it's certified organic. It's a federal FDA registered facility. It is kosher. So as far as dosage goes, it's really based on your metabolism, your genetics, and what are you using it for? Pain, inflammation, anxiety, or depression. With regards to a dog, as Scott was going to mention, is that based on the size of the dog. So for instance, I had two 75-pound golden doodles, we were giving them to start a half a dropper full to see how it reacts. And after 3 to 5 days, if I didn't see any reaction, I increased the dosage to a full dropper full. And with the particular dogs that I had, within 10 days, I had a new dog. It was absolutely amazing. He was able to push up off the ground, start playing with his brother again. And again, as Eric mentioned before, there's no placebo effect. Either it works or it doesn't. And Anita, we have dogs, cats, ferrets, iguanas, and even a parrot that's on it.
Well, wait, well, we want to make sure that it can't hurt either the human or the dog. So can it ever hurt anybody? That's what people want to know.
Well, I'll let Eric speak to that because he's our science geek.
Let me tell you, and hold up. First of all, did he just call me a geek? So hold on.
That's cool.
But I am a science geek. I'm telling you, and I'm gonna let you know. Look it up, Google it. There has never been an adverse event with a CBD oil, ever, never, ever. And that's the thing. It only helps. It doesn't hurt. And that's the whole, I'm a science guy. I'm telling you, CBD1 like receptors are like for your nervous system. CBD2 nervous system, like CB2 receptors are like focused on your immune system. And I just don't know. There's never been an adverse event associated where they have documented that CBD oil has ever hurt anybody.
Okay, so Scott, after hearing that, are you back now on your sound?
Yes, ma'am. Dan told me I
Okay, let's talk about that. Tell me what you use it for, what you've used for your dogs. How have you known what to do?
Well, first of all, my sister had a cat that was 18 years old, and the vet gave it about a month to live, and I started giving it our pet product, and it was lethargic and would not move, and now it's jumping back on the counter. It's 21 years old, and it's incredible, because she loves her cat. And I would like to also say that Rob was talking about, we are USDA certified for organic. And there's not many products out there. So we also bring our product from the greenhouse in the seeds to the fields. And then we go ahead and process them and extract it. And then it's sealed when it's left the farm. So it's from hands-on from the get-go.
Oh, so that, yeah. And see, I'm sure a lot of the people who you see, the reason I think this interview is important is we see advertising for CBD everywhere, and as you said very smartly, buying sushi. Oh, that was Rob maybe said about, would you buy sushi at a gas station? No. So I think people are so desperate, Rob, that they'll do anything. But after listening to Eric and to Scott too, people should try it as long as it's not going to hurt them, and it could only do much better for them.
Well, Anita, let me make a point also, because right now the shiny object in front of everybody is CBD. Okay, yeah. But that is one of the compounds that's in our plant. Our plant has over 100 different compounds. And what they have discovered in research is that something called the entourage effect, which works on the endocannabinoid system. So you need all the different compounds, just not CBD. So you'll see our bottle says hemp oil extract because it has all the different compounds from CBC to CBN to CBG plus CBD. So if you're just taking CBD, you might not get that entourage effect. So you need a little bit of THC and the other compounds plus terpenes plus flavonoids. That gives you that entourage effect.
That's amazing. I'm so glad that you're so well schooled in this. So, Dr. Fein, so you're, this really is why that you're so involved with this, because I know you have a great reputation and you wouldn't touch something that you thought was phony.
No, I would not. Just to tag on to what Rob was saying, that the CBD isolate is also a lot more expensive and it's not as effective because it doesn't have the other components to it that also, contribute to anti-inflammation and things like that. The anti-inflammatory component, I think, is really crucial here, especially when it comes to disease. We know that disease is very, very much rooted with inflammation. And so that's why I think there's a lot of healing qualities to this, because it helps with it, you know, reduce the inflammation so your body can, you know, can just heal itself and function better. For example, I had a patient, I actually wrote down what they wrote. He had swelling in his hand and his wrist. He had just had surgery, and they could not do physical therapy with him because the inflammation was so great, and it was interfering with the mobility and the range of motion. So I actually, you know, I have cream in my office because I'm always using it. So I just let him use some, and his wife, she was in with him. She wrote, FYI, the dwelling in, I'm going to use his name as D's hand was remarkably reduced within an hour of our appointment. He's ordering the cream. Many, many thanks. It helped bring down the swelling, which gives his fingers more flexibility. We're encouraged. And he went to physical therapy, and within 2 weeks he was back to normal, which would not have happened if we had not used that cream.
I am just so impressed, and you know, the whole team here.
Another one, I had a patient who decided, you know, she wanted to try other brands. She texted me, "Good morning, Dr. Fein. I need to reorder the CBD for me and my dog. My dog has cancer, and I want to order the brand you recommended, as I've tried others and they are not the same."
Oh, wow, that's great testimonials, Dr. Fein. That is fabulous. So,
yeah,
you know,
and I have a lot of those.
You do. And
yeah.
how did you find the perfect edge? Because you said your son needed something. How is he doing, by the way?
He's doing fantastic. He's doing absolutely, and it also, ironically, it helped him. Now, there's no research on this, but it did help him with his attention, because what do we know about ADD and anxiety? They usually go together, but once the anxiety is reduced, then people can think better. And it just helped him with concentration, which I was amazed. I didn't even expect that.
Well, this is a wonderful conversation.
Of friends, and he's just a happy camper doing fantastic.
Well, I think you better order a lot more, Scott and Rob and Eric, from where, you know, you better start growing more, because this is getting out of hand. It's so good. So, you know, when I think about it, Eric.
Really good stuff. And I'm, you know, being a science guy, I'm gonna tell you something. This is like you can't possibly explain, like, if you take the cream and you rub it, like your shoulder hurts or your knee hurts, rub it on there and see what happens. And it's just, it's amazing. And we bring it to all of our, you know, I'm the president of the National Football League Players Association for Florida. And I'm telling you, I don't think you understand how much pain these guys are in. It looks like a filming of Dawn of the Dead. It looks like when they walk, and like we walked up to a place called Top Golf, and it was like there was all these steps, and you should have seen it. But I'm just saying, it's just I so believe in this stuff. And this product, it's like there's a lot of junk out there. There's a lot of junk. And if you go to like Miami, if you go to Scotty, what's the name of the of Channel 6? If you go to that, they tested like 12 products, and one of them had, or two of them had what they needed to have in it. Everybody else didn't. The composition of the product was not the same as what they had listed on the
Well,
box.
we're running out of time. This has been great, and we just want to thank all of you, you know, from Scott and Rob and Eric, and of course Dr. Fein. And I'm so happy to hear about this. So if you're interested, of course, we know that you have to go to perfectedgebotanicals.com. Is that right, Rob?
That's correct.
Go to the website, perfectedgebotanicals.com, and we'll have this show on our TV, our Zoomer Times TV show. And I want to just thank you all again. I mean, I don't think anyone should buy it anywhere else, and start getting on it. Get your dogs on it. Get your grandma on it. You know, get your monkey on it. Get whatever you have. You know, now we have iguanas. Don't put it on iguanas. They'll probably grow bigger. Don't do that.
And Nina,
Thanks,
I also wanted to add that you can go to orderpeb.com to see our products and everything there also. And I'd like to thank Michelle because she's also my doctor.
Oh, right. Well, that's right. Well, Dr. Sparrows is my doctor, and Dr. Fein, I have recommended her.
Doctor too.
Thank you all so much for being with us.
Thank you, Anita. Thanks, everyone.
Thanks, Dr.
Thank
Fein.
you.
You can enjoy
Thank you,
your
Anita.
Saturday now.